At Healthwatch Surrey, we champion the voice of local people to shape, improve and get the best from NHS, health and social care services. This year, we listened with compassion to neurodivergent individuals about their experiences in secondary care, explored what matters most to college students and supported family members in planning for their loved ones' future care needs. But these are just a few small examples. You can learn more in our annual report. This year, over 2,000 people shared their experience of health and social care with us, and over 400 sought advice and information from our help desk. Our help desk provides clear advice and information on topics such as complaints procedures, social care funding, accessing GP practices and mental health support.
You have been fantastic. I don't feel as alone in this process now I have spoken to you.
Our report highlights our important role as an independent, critical friend. Following our recommendations, based on what people had told us via surveys and engagement events, some significant changes to the assessment criteria used by the Surrey Pharmaceutical Needs Assessment Steering Group were made, ensuring that pharmacy provision in Surrey was evaluated based on what really matters to people. Our report also demonstrates our role amplifying the voice of people who face barriers to accessing support and those at risk of health inequalities. For example, thanks to feedback from one resident, training was provided to GP practice staff on how all patients who are less digitally able must be supported to ensure they can obtain an appointment how and when they need it. We are independent, and this independence has enabled us to share findings which are 100% person-focused. We visited care homes, community settings and Age UK Surrey, planning for your future care events, speaking to people about what information and advice sources they would turn to when looking for care homes. Our findings and recommendations have helped to guide Surrey County Council's planning for your future awareness campaign strategy, including materials to share with care homes to ensure it really meets people's needs. This year, we have been particularly proud of our work acting as a bridge across sectors. Following our 2023 report highlighting the importance of a formal neurodiversity diagnosis, we were made aware that diagnostic delays were causing concern and confusion for patients and carers. We shared this with providers and asked for assurance that people were being appropriately communicated with. As a direct result, a comprehensive communication plan was implemented, including regular updates to parents and all stakeholders and a webinar for schools to reduce the distress and worry induced by such delays. As well as being independent, we are trusted and impartial. Based on our report looking at the experiences of neurodivergent people having outpatient appointments, providers made a number of significant changes to improve the experience, including the appropriate placement of designated areas for those with additional needs, a review of appointment letters and website updates to ensure accessibility. We are always delighted to hear when our work helps to make a meaningful difference to patients, and enjoy working closely with our system partners to make our recommendations a reality.
We acknowledge to date that the experience for our patients and carers needs work and focus, and the lived experience in this report truly helps develop this work. We have used this report to develop our commitments in response to the experiences highlighted.
You can read our annual report on the reports page of our website. Visit www.healthwatchsurrey.co.uk.